And on Healthbeat today, we want to talk about something that doctors say should be on your radar, your bone health. Our Healthbeat anchor Anne-Marie Tiernan joins us in studio with the doctor's advice. Hi, Ann.
Well, hey there, Scott. I'm here with Dr. Steve Samuels, who joins us today. Thank you for coming from Franciscan Health. And we've been talking, and you brought up a really interesting point about how, you know, we have so many things that are on our radar about cancer prevention and things like that, but we don't really talk about our bone health. Why is it so important?
Well, it's extremely important. Fractures later in life can lead to a very high mortality rate, and so it's something you want to diagnose ahead of the fractures. You don't want to be treating at the fracture. Just like in heart disease, you want to treat the cholesterol ahead of time, the high blood pressure ahead of time. Same way with your bone health. You want to be treating the bones before they fracture.
But part of the problem is detecting if there is a problem, and the screening guidelines right now, you would argue, maybe not effective enough.
Well, there's all sorts of different guidelines out there, so which ones to use, but the most commonly recommended is the United States Prevention Task Force on Health Maintenance Screening, and their guidelines probably aren't good enough at this time. They recommend all women over age 65, but menopausal women, they only recommend if you really have a lot of risk factors for fracture. And what the newest studies show is that 3 out of 4 women with osteoporosis are missed if you use those guidelines. So that's not good enough.
No, and you do want to be caught early, because I think this prop that you brought today is just very impressive about a before and after. Tell us about what we see here.
What we see is normal healthy bone here. This is severe osteoporotic bone, and this is what we actually can do with the medication. So you do want to find out there are treatments. If you've lost the bone, ideally we want to keep you here, so the earlier we catch you and the less likely we let it get down to that severe loss, the better we can bring you back to normal healthy bone, and that will decrease your fracture risk by up to 60%.
So what should we as patients be doing when we're, you know, to make sure that we have healthy bones? Should we be taking calcium?
Well, the most important thing is early in life with our children. Your peak bone mass at age 21 is the most important risk factor for developing future fractures. And so we want to push our kids to do aerobic activities, things that have impact with them, sporting activities. We want to also load them up on calcium, either calcium supplements in our girls or milk in that young patient population.
But what about milk in the older population? A study came out last week that I found just really interesting.
Yeah, very, very interesting study. Large observational study looked at women and men who drank at least 3 glasses of milk a day, or who didn't drink almost any milk, less than 1 glass a day. And the people that drank all the milk actually had a higher mortality risk and even a higher fracture risk. So kind of surprising data there, but milk maybe not what's good for us.
Okay, so for our call to action then is the conversation with our doctor.
Absolutely. When you're discussing all those other health maintenance screens like mammograms, colonoscopies, pap smears, your vaccinations, ask about your bone health and should you be screened or not.
And tell us, what is that screening and what is the result of it?
It's called a DEXA scan. It's a x-ray of your bones that will tell us how fragile they are. It'll rank you as either normal, osteopenic, mild bone loss, or osteoporotic, full bone loss. Both the osteopenic and osteoporosis can be treated with medications and improve that bone mass back towards normal. And
you said you can almost see when a patient comes in. What does an osteoporotic patient look like?
One of the biggest risk factors is either normal body weight or low body weight. And low body weight in a female who is now post-menopause, it's a very, very high risk for osteoporosis in the patient population.
And what does our race have to do with our risk?
Caucasians are at higher risk than African Americans, absolutely. Women, smokers are at higher risk. And again, the body mass. That's the single most important thing. If you have a normal body mass or low body mass, you probably want to be screened as soon as you go through menopause.
And the reason why this is so important, and we're talking about it, is that when you're a senior, and if you fall, perhaps you fall and you fracture your hip, then there is just a domino of not good news after that.
60% one-year mortality. So at 1 year, 6 out of 10 people will be dead from that hip fracture. So it's extremely important that we prevent you from getting there where your bones are at risk for fracture.
And what's your message to seniors that know that they're in this risk category and maybe they are prideful about using walkers and canes?
Preventing the falls that cause the hip fracture as well. Don't be afraid to ask for help. You can get a home safety evaluation done where a therapist will come out and look at your home and look for risk factors for falls. Using a cane a little bit earlier than you think you need it, or moving on to a walker a little bit earlier than you might think you really need it. Don't be ashamed to use one.
And what do you say about slippers?
No slippers, ideally.
Throw out the slippers.
Good tennis shoes, wide-based tennis shoes that are tied all the time.
All right, so our takeaways today. Ladies, make sure that you're talking to your doctor when you go into the office and saying, should I have a screening for osteoporosis? Also, parents, make sure that you're working to get that bone density in young female patients at its maximum by 21 years old, and that really can help them and set them up for a good bone health later in life.
Absolutely.
All right, Dr. Steve Samuels from Franciscan Health, thank you so much
Thank
for
you for
joining us
calling me.
today. Some really good tips. Scott, that's a Health Beat today. Back to you.